Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
Thanks for joining me. Today we're going to restore this old bonding that you can see here. It's on a front tooth. It's starting to get a little stain around the edges. Patient doesn't like how it looks. The color doesn't match very well anymore. So let me just circle that for you so you can see better what I'm talking about there. And this is a bonding that I did previously back, in fact, in February of 2002. So almost over 22 years ago. Back then I was using some Parkel products. The bonding agent I use, you can see there, Touch and Bond, and then the composite resin was Epic TMPT shades C2. I use different materials now, so we'll see how it looks after we're all done. Alrighty, the first step I like to do for when I'm bonding on a front tooth is to use a rubber dam. It just makes it easier, keeps the tooth dry while I'm working on it. Keeps the lips and cheeks out of the way. I'm just stretching the rubber dam out onto the rubber dam frame. And I find with front teeth, a lot of times I don't actually need to use a clip or anything. I can just stretch it around, maybe use some floss or wedge it to keep it in place. There's a better, closer look of the old filling. And first thing I'm going to do, just with my high speed, I'm going to remove just the composite. Right now, I'm just trying to remove the old composite resin and not adjust the tooth at all, not trim the tooth up. Once I'm all done removing it, I'll go back and bevel, make sure the enamel's got a nice bevel to it. But just gently, very, very light touch, tiny little bit of water just to remove the old composite. I find sometimes too with older composites, if the bond starts to break down, it'll just pop out. This one, I must have bonded it pretty well 22 years ago because it's in there. Now I switched over to a round burr on my high-speed handpiece. Again, just to get in there a little bit better. I got a little bit more control just to remove that, go into the deeper parts. Now, originally, 22 years ago, I replaced another old bonding that the patient had. Patient initially had some staining on the middle of the front tooth that they didn't like the looks of. And so her dentist previously placed some bonding, and I've been replacing it from time to time when it needs it. Now I'm just using my Explorer to see if any of the composite is loose so I can just flick it out of there. Now I thought I could get it moving a little bit, so I switched to a sickle scaler, a little harder, but now nothing's coming out. So back to the round burr in the high-speed handpiece just to remove that last little bit of composite resin there. And now I'm actually starting to bevel around the edges of the filling as well. Rinse and dry. And there you're starting to see a little bit of the staining that was underneath, like right there on the corner there. So still a little bit more of the old composite left. Usually I like to try to remove all the old filling material just because then I know I'm bonding to healthy tooth structure and I'm going to get a good bond. Sometimes to an old filling material, if you try to bond to old filling material and if the bond's not as good as you think, again, just going back in with a scaler to try to flick it out of there. If the bond's not that good, you could end up having trouble. Now there, I've uncovered enough of the staining so you could see it pretty well. Now I switched over to a round burr and a slow speed handpiece again to see if I can remove a little bit more of that staining, a little bit more of what's left of the composite. And that staining was pretty dark. It wasn't a cavity, she tells me, so I'm going to assume it was some fluorosis or some other issue. Okay, so now the tooth's prepped, and let me just give you a close-up of that's the tooth, and there's the staining right there. So that's that deep part of the tooth that we're going to remove that. I'm going to I can't remove it all because I don't want to go anywhere near the nerve of the tooth, so we're just going to cover that up with the composite. So I'm just checking shades, and I think we're going to go with A2. I'm going to have a base layer, and then I'm going to have the enamel composite replacement. So I'm just cleaning the tooth off with some Clean and Boost, and just basically just to make sure it's a mild etch. Clean and Boost is a mild etch and just helps remove any handpiece oil, any schmutz on the tooth, so we get a nice clean base, clean tooth to bond to. And we just scrub that in there for 10 seconds or so, rinse it off very well. Once I rinse it off, then I dry it really well, and now we're ready to start placing the composite resin. And again, my favorite is Surpass. So first application is Surpass 1 out of the green bottle. That's basically the primer etchant. It roughens up the tooth microscopically. So we put that on there for about 10 seconds or so. And then after that, we can start putting 3 layers of Surpass 2 to kind of neutralize the etch. And this you just dry off. I find that using Surpass so much simpler than the old way of etching with phosphoric acid for 30 seconds, rinsing it off, drying the tooth, not too dry, not too wet. This makes it so much easier. And then finally the bonding agent, which is the Surpass 3. Put a nice layer of that on there, air thin it, and zap it with my Velo gland, curing light for 10 seconds. Now, once that's set up, now we're ready to start restoring the tooth. And I'm going to use it, last time I used C2, just one color. This time, I'm going to use a little bit of A2 shade flowable. This is Titan by Vista Apex. I'm going to put that in there, and I basically just want to cover a thin layer just to kind of mask that staining that was there so you don't have that shining through. I'm just using the brush from my Surpass 3 to kind of smooth it, adjust it where, just the placement of the flowable. Zap that for 10 seconds with my Velo Grand, and then we're going to be ready to start putting the final composite shade. So this time around, I'm going to use, instead of a C2, I'm using Omnichroma, which I've been using lately, and I've been very happy with it. Omnichroma is kind of a translucent composite. They call it a universal composite. You put it on the tooth, and at first it always looks a little bit lighter than the tooth, but once you cure it, it blends in with the rest of the tooth. It's kind of magical how it disappears. And I'm using my cord packing tool, nice and long. Zap that with for 10 seconds with the Velo Grand, and we just keep building it up. Now, I love using that cord packing tool to place the composite, just because look at the length of that blade. I can actually put the instrument against the enamel on the top edge of the tooth, closer to the incisal edge, and against the bottom edge of the tooth, and it'll give me the proper contour. I also use some seam free to kind of, so that I get a very good, so that I can get the composite to get a great I can smooth the composite down very well without it sticking to the instrument and getting pulled and dragged. I've tried other techniques over the years, dipping it in the bonding agent, using alcohol wipe in between, but I find the seam-free makes my life so much easier placing the composite. And again, when I'm placing this, I want to do as much shaping and smoothing. I want it to be finished, basically, when I'm all done. Again, this is easy with that long bladed instrument. I can just use the rest of the tooth to guide me. Now I'm just checking, make sure it's not over contoured on the front, and I'll blast again with the Velo Grand for 10 seconds to set up the material. Now once this is all set up, there should be minimal flash, there should be nice and smooth. I'm not going to have to touch it with the high-speed handpiece. Let me turn the light back on, and there you can see it. And it's just magical how that composite just kind of blends in, disappears, just removing any little bit of seam-free. The only thing I'm going to do is I'm going to take my Jiffy polisher and just polish that up a little bit. Smooth down any little bits. Basically what I'm doing now, just removing any bonding agent that's on the top surface. I just want to, sometimes that leaves kind of a little bit of grittiness, funny feeling to the patient's tongue. I found hitting it with the Jiffy polisher makes a huge difference. One final cure it with the Velo Grand for 10 seconds, and then we're all done. Let me put a side-by-side up so you can see the difference. Wow, it just blends in. It's amazing how great that Omnichroma looks. And there's the before on the left and the final on the right. Thank you all so much for watching. Please hit that thumbs up button if you enjoyed this video. Consider subscribing to the channel. All right, see you guys next week. Peace.